but I see people are waking up to the possibilities, and the reality is, and I have direct primary care here in Panama. My doctor here is direct primary care.
That's good.
And oh yeah, and it's terrific. So I'm totally on board with it. But the reality is that most people don't know what comprehensive primary care is, and they have no cultural influences about it and its importance. And that's got to be a challenge for you to educate them. So what do you wish they knew about your practice before they walk through your door for the first time?
Yeah, that is a big challenge because I'm the only one here. And, Newport News, and it's called the Peninsula. I guess it's almost 1 million people on the peninsula. I'm the only one here. So I'm having to teach everybody what direct primary care is. And they're skeptical, and I don't blame them. I'm only $75 a month, and I've had people question, if I'm even a real doctor. They can't believe that, why am I so cheap if I'm a real doctor?
So the response there would be, well, maybe you should think about it as, why is everyone else so expensive?
Yeah, well, that's what I said. Why is your health care so expensive? I know. I said, well, you can Google me. I said, I'm fully licensed by the state. I'm board certified. Never been sued. So I said, that's what I turned it around. I said, the question is why is your health insurance so expensive? I said, because this is actually affordable. I told them I cost half a cup of coffee a day. That's all I need.
So what
I want them to know is that's what I want them to know is that health care is very affordable. I got somebody, the insurance company was going to charge somebody for a life-saving medication. The person had a kidney transplant, and they needed some medication. And then, not the insurance company, the pharmacy was going to charge them $900 a month. $900 a month. I found it for them for $90 a month.
From 900 to 90.
900 to 90.
That pays for their membership, $75.
Yeah.
A month. Yeah. I mean, hello.
And delivered to their door for $4 a month.
Which saves them time, money. Boy, how do they feel? I mean, how do they feel after they've been with you now for 2-3 months?
It's a mixture. They're glad they found me, but they're very angry also at what's been going on.
The realization that they've been taken advantage of.
Yeah.
Wow. Is it fair to say that direct primary care enables you to live your life's purpose?
Yes, without a doubt.
It's got to make your job a lot more enjoyable.
I have a lot. The satisfaction is so much higher. It feels like I can be a doctor again.
It strikes.
I had a patient that we went out of town for 2 days for July 4th. I came back and they did the decal for my door because initially I just had a paper sign that I'd stuck up on the door, and they did the window decal for me.
Wow.
Yeah. Another guy gave me a megalodon tooth that he dredged up out of the James River.
Gosh, I mean, that's one of those. What I'm sensing here is in a real way, you're practicing what we had 75 years ago, a true family doctor who knows their patients and was there for them. In your corner care is the way I put it. But they did house calls, not calling on the phone, but they went to the house. So they knew.
Do house calls.
You do house calls.
I had a patient call, or a patient's son call this morning. He's elderly, and he fell last night. I said, well, let me come see you. I was going to come see him right after this podcast.
Well, it also enables you to do something else, and that is you get to see how patients, where and how they live.
Yep.
Which is an important part of the whole picture of the patient. It's not just a chart and looking at a piece of paper. It's being able to listen and take time and get to know them, because it's all part of stress. And of course, now we know stress is really important. It's one of the things that I made sure, the doctor here made sure that I was tested for, my stress levels, and everything came out fine. And so that's good. He said, that's good. But it kind of reminds me of the old beat cops walking around the neighborhood. They knew the people they served. And then along came patrol cars, and in medical parlance, that would be the insurance companies and government. And they became the norm, which the patrol cars broke the relationships. And it didn't help crime statistics. So you're doing house calls.
I'm doing house calls, yeah. I did one last week, too.
And the funny thing is, and a lot of people who are younger, I mean, I'm pushing 60. I'll be 60 in December. So I remember quite some time ago, my family physician, when I was a young kid, I mean, sometimes he didn't get paid with chickens or an apple pie, but a lot of doctors got paid with like a barter. But it showed the patients were showing their appreciation, much like the person who did your sign, and also the respect for your time and your expertise and for the care. And so now someone actually drops off a shark tooth, a megalodon tooth.
Yeah, it's as big as my hand.
Wow.
Yeah, it's cool.
That's one of those, what a great story. And it says a lot about how people appreciate what it is that you're doing. And that's the kind of thing that it makes it's got to make you feel really terrific.
It does. It does. It makes me appreciate the patients more too. I mean, that was a really nice gesture.
And not only that, from a patient standpoint, and it's probably obvious, I kind of want a doctor that loves what they do, gets up in the morning and, what can we do to make life better today? And, in your corner care. I mean, who wouldn't want that?
Yeah. Well, I drive to work today now thinking, well, who can I call? Who do I need to check up on? And I'll while I'm sitting around drinking a cup of coffee, I'll send, we got texting now, which I never had, we didn't have in the past. And so I'll shoot they like to communicate with text, so I'll shoot a bunch of texts out saying, need anything, any refills, how's it going? Yeah, it's nice.
So a couple of things that I've observed over a number of years now about direct primary care, and I pay attention to the naysayers. And my dad used to love a saying that he attributed to Confucius, and that was, "Man who say it cannot be done should not interrupt man doing it." So he was a public speaker, and people love that phrase because there's always someone who says it can't be done.
Right.
And anyway, so one of the things that I've heard about direct primary care, and then I kind of chuckle at now because I've heard it often enough, is that it's not scalable. In other words, you're not going to be able to build this to a point where it makes a dent in what's going on in healthcare. So what do you think about scalability?
So right now, 80% of health insurance claims were for the family physician. Last year, only less than 10% of medical students went into family medicine. That is an incredible mismatch.
Sure.
An incredible mismatch. So this direct primary care allows me to make enough money to pay my school loans. They're not going into direct to family medicine because they can't pay their school loans.
Yeah.
I mean, when I'm done paying mine, when all is said and done, it's going to be $200,000, and there's as much as $400,000 in the hole now.
Hey, thanks for listening to another healthy snack from the winning healthcare food fight snack bar. If you're finding them tasty, please click like and consider subscribing to have more guilt-free snacks as they're served. Listen to the full show by following the link in the description.